Hello and welcome to the breakdown with Dr. Mooney. If you haven't already, go ahead and hit subscribe. Today we are talking about measles. Measles has been everywhere in the news. You may have heard about it from your doctor's office, the TV, Instagram. Everybody is talking about measles. And today we're going to get into the why. Measles is back. In 2000, the United States declared measles as eradicated in this country, which means it was eliminated. That means for almost the last 3 decades, measles has not been present in the hospitals, it's not been present in medical education, and that means 2 entire generations of medical doctors, nurses, and trainees have never seen this virus. However, measles used to kill millions of people every single year worldwide. Measles is one of the most highly contagious viruses that the human body has ever experienced. For example, if 10 unvaccinated people are put in a room with measles particles, 9 out of those 10 people, no matter whether they're healthy, whether they're an athlete, doesn't matter. 9 out of 10 people will become infected with the measles. It's insane. Also, what makes measles so dangerous is that the particles or the droplets that are left after a person coughs or sneezes in a room that is infected with measles can last in the air for up to 2 hours. This means that you can enter a room almost 2 hours after that person has left and still become infected. We rarely see those kinds of numbers with any other viruses that we're used to treating and fighting. As doctors, nurses, and other healthcare professionals, we are now having to learn about how to recognize measles and to act quickly, but the same education needs to be given to you as the general public. Hopefully, with a bit of education, we can get enough warning to the public to save a few lives. Now, measles used to be a very common infection worldwide prior to the vaccine in 1963. It's said that up to 30 million people per year were infected with this, and it caused up to 2 million deaths per year. Every child prior to the age of 15 back in the day was exposed to measles, was recovering from measles, or had long-term disability due to having measles. But you know what they say, right? What doesn't kill you makes you stronger. Wrong. Those who survived with the virus were not guaranteed to make a full recovery. Common long-term effects of having measles were deafness, scarring of your lungs due to pneumonia, permanent brain damage, disability, suffering, and eventually death from a condition known as SSPE. So I hope that lets you know how serious measles used to be. Once that vaccine came out in 1963, our CDC decided that our mission was going to be to eradicate the measles by 1982. This didn't technically happen. There's a lot of factors at play when you try to vaccinate an entire country against an illness that is smarter than us more often than not. However, we did achieve this goal in the year 2000. Measles being eradicated did not mean that there were 0 cases of measles. The virus still exists in other places. However, it just meant for 12 consecutive months, the levels of measles that US citizens were experiencing were not growing month after month. Most of the time, anyone who was exposed to measles got their exposure in another country, traveled back to the United States, and that is how they were infected and infected a small amount of people around them. Unfortunately, due to a large drop in the amount of children who are becoming vaccinated for measles, we have lost our herd immunity. That means many of us are at risk for developing this virus yet again. So, what happens when you get the measles? Best case scenario, you get a cough, runny nose, flu-like symptoms, and you feel better within a few days. But worst case scenario, measles can cause pneumonia, inflammation of the brain, and death. All caps, death. You can die from the measles. Measles kills up to 3 of every 1,000 children who get the virus. Now, I know what you're thinking. 3 out of 1,000, those odds aren't that bad. I'll take my chances. No! What is wrong with you? Anytime a child dies from a completely preventable disease, it's a tragedy. Every child's life matters. It wouldn't matter if it's 3 out of 1,000, 1 out of 1,000. If any children are dying from a virus that we have access to vaccines for, it is a tragedy. period. Measles is a contagious respiratory disease caused by the rubeola virus. Symptoms typically occur 7 to 14 days after the original exposure. For almost 2 weeks, you could be spreading around measles particles and not even know. What you're typically looking for a presentation is a very high fever, think sometimes even greater than 104. Also, it has a telltale rash that begins on the face typically and spreads to other areas of the body. It is very important to note that this stereotypical measles rash that you see in textbooks does not apply to skin of color. The rash will look different in me than it would in somebody who is Caucasian. Now, I've left a link down below so you can access the CDC's database of what measles rashes look like in different skin tones. Other than this rash and sometimes some white spots in the mouth called Koplik spots, there's not too much that will differentiate the measles from any run-of-the-mill virus. That's another reason why it is so dangerous and hard to catch. Like many viruses, measles is spread by droplets. So basically from people, hachoo, coughing and sneezing in public with no mask, without washing their hands, and releasing droplets into the air. If you come into contact with those droplets, as I said earlier, for up to 2 hours after that person leaves the room, you can still become infected. But also, if that person goes wipes their hand on the desk, you come up behind them and touch where that desk was, and then you scratch your eye, you rub your nose, or you eat some food, boom, now you have introduced measles into your immune system. Unvaccinated children, of course, are who we mainly talk about when it comes down to measles. However, did you know that people who are immunocompromised or pregnant can also be at risk for a measles-related incident? Babies under 1 year old cannot receive the measles vaccine. The first dosage of measles comes at 12 to 15 months, and the second dosage comes at 4 to 6 years once that child is about to enter school. However, if you missed your child's vaccination window, if you yourself were never vaccinated against measles, it's not too late. You can choose to get the measles vaccine whenever you want. All you need is 2 shots of that measles vaccine in order to feel comfortable and confident that you have done your part to fight back against this virus. Also, with most viruses that we have been vaccinated against, as time goes on, our immunity actually decreases. Anyone who has ever worked in a jail or in a healthcare system knows that we have to get something called titers, which a titer is basically just a lab test that shows whether or not you're still immune to certain conditions. For example, my titers were through the floor. I had to go and get a repeat MMR or MMRV vaccine in order to be able to work in the hospital because my immunity to measles waned. If you're not sure about your immunity status and you want to inquire, have your primary care doctor put in titers for you so you can see whether you need a booster shot or not. Measles is usually diagnosed by the clinical picture. Does that person have a rash? Does that person have those white spots in the mouth? Were you exposed to measles? Did you travel recently? Are you having a fever that's up to 104? Those kinds of things usually allow us to make a clinical picture that fits with measles. If you're in a hospital or a clinic setting, they may do confirmatory testing through the blood. They may do a swab of your nose or your mouth to be able to know whether or not you have measles. But I will mention again, there is no cure for the measles. If you are going to seek care because you believe you have measles, call the doctor in advance and let them know so they can escort you directly into the office and directly out without coming into contact with any other children. So if you've heard about being exposed to measles, what do you do if there's no cure? Well, acting quickly is of the utmost priority. If you tell your doctor within 3 days of exposure that your child or yourself has been exposed to measles, you can still get the vaccine. Within 72 hours, you can still get the vaccine, and hopefully your symptoms do not evolve into true full-blown measles. Now, if your child is under the age of 12 months, if you are a pregnant person or immunocompromised, and you've been exposed to measles but can't get the vaccine yet, it does not mean that all is lost. If it's been less than 7 days since you've been exposed to the virus, you can get something called immunoglobulins, which are basically a burst of antibodies that can help your body fight off measles. It's important to note, If you get the measles vaccine after being exposed, you do not necessarily need to quarantine. But if you have been exposed and are just getting the immunoglobulins, you do have to quarantine yourself and your family for 21 days. So if you do get the measles, what do? Rest, fluids, relaxation. Do not take antibiotics if you think you have measles. I repeat, antibiotics will not work against a virus. Antibiotics will not help measles. If you start getting short of breath, it could be likely that you need oxygen. Please call your doctor or call the emergency room in advance and let them know that you're at home suffering with measles and that you are having some respiratory distress. They will arrange how you can come in as safely as possible to not affect others around you. You may have heard online that vitamin A is being given to help boost the immune system for some of the patients that are diagnosed with measles. However, vitamin A is something that should be given under the care of a medical doctor because too much vitamin A causes vitamin A toxicity, which is not good. It is possible to overdose, for lack of better words, on vitamins. Let your healthcare professional guide you through this process. Remember, measles is horrible. This is a horrible virus. This is a horrible disease, and I can't believe that we are back here again. Measles will likely kill several people before this outbreak is done. All of this is preventable. It's not too late to change your mind. If you're not vaccinated, if your grandkids aren't vaccinated, if your neighbors aren't vaccinated, please just let this be that one time that you dig your heels in and fight. If we want to keep our loved ones safe, vaccination and prevention is the key. Thank you for listening to my very passionate video. I just can't believe that I, in 2026, am having to learn how to treat measles. Please remember, if you're sick, wear a mask, wash your hands, and keep your family safe. Until next time.